what are the most significant factor in deciding the shape of hairline and choosing the distance of mid-frontal point, that is the mid-frontal point from the mid-eyebrow point. The first factor is age of the patient. The second factor is shape of the face, whether it is Caucasian like triangular or whether it is a oval like Asian. The third is grade of baldness, whether it is grade 3, 4, 5 or it is 6, 7, 8. And the fourth one is status of donor area, whether the donor area is healthy, having thick graft, having good density, or when the donor area is of compromised nature, like when it is not having thick hairs and having not good density. And fifth one is what the patient, what the client want, what is his expectations. So the first factor is age of the patient. When the patient or client is in between the age of 20 years and 30 years, the distance between the mid-frontal point, that is called mid-frontal point, and there is a mid-eyebrow point or glabellar point, it should be 6.5 centimeter to 7 centimeters. When the patient's age is in between the 30s and 40s, the distance should be 7 centimeter to 7.5 centimeter or 8 centimeter. When the patient's age is more than 40, then it should be obviously put higher. The mid-frontal point should be put higher, or it should be the length of at least 8 centimeter from the mid-glabellar point.